News coming in right now. India intensifies readiness as cases in China soar. Center asks states to ensure availability of medical oxygen, functional life support equipment at hospitals. Center says oxygen control rooms should be reinvigorated at states and union territories level for prompt resolutions of oxygen-related issues and challenges. Milan Sharma, my colleague, is now joining me live on this. Milan, give us more details as to how the center is preparing for any eventuality given that cases in China continue to soar.
Well, we're looking at the pandemic preparedness plan of the government of India, wherein a mock drill that's majorly going to be happening at all the hospitals across the country on Tuesday is being worked on. And certainly the details that we have from the letter that's been written from the union government to the states is that there will be a checking of how many PSA plants, how many oxygen plants, and how many COVID beds are available in each and every state and country. Remember, that data is clearly available with the Indian government, but of course after the ebbing of cases in India, the hospitals were once again converted into non-COVID facilities and for elective surgeries, etc., that were not getting the important time. And now once again, with the cases surging in China, the international rule for flights that has been made is the mandatory RT-PCR test, which the passengers will have to take international arrivals from China via any such country like Hong Kong, Thailand, South Korea as well, and other such nations. But interestingly, the United States and Brazil is not added in this list currently by the Health Ministry, where cases continue to surge there as well. Apart from this, of course, there will be constant review meetings that will be held between the state health ministers as well as the union health minister. And next week, of course, we'll also be looking at a new option for the precaution dose, which the government wants people should come forward and take, which is the Bharat Biotech's nasal vaccine. It's already available on the CoWIN and will also be under price negotiation so that people can move forward for a needle-less and pain-free precaution dose as well, because the coverage is less. So this is broadly the plan for the Indian government on pandemic preparedness for now.
Right. Milan, thank you so much for joining us with all of those details. Now, as a global alarm spreads over the COVID-19 mayhem in China, the center is taking control by ensuring hospital infrastructure and other COVID-19 preparedness measures are ready. Meanwhile, the radar on international travelers is also heightened with random testing of 2% passengers arriving on international flights that has started from today. Union Health Minister Mansukh Mandavia said that visitors coming from China, Japan, South Korea, Hong Kong and Bangkok will be under surveillance. They have to upload their RT-PCR test reports before travelling to India, and once they arrive in India, they will have to undergo thermal screening. In the process, if anyone is found to be symptomatic or detected COVID positive, they will be quarantined with immediate effect.
चीन में जिस तरह से कोविड महामारी फैल रही है, उसको देखते हुए चीन, जापान, दक्षिण कोरिया, सिंगापुर, बैंकॉक सभी से आने वाली फ्लाइट को तुरंत ही एयर सुविधा के माध्यम से सभी पैसेंजर को ट्रैक किया जाएगा। पैसेंजर पहले से ही आरटी-पीसीआर रिपोर्ट अपलोड करके ही आएंगे। इंडिया में आने के बाद भी उसका थर्मल स्कैनिंग किया जाएगा और कोई पॉजिटिव पाया जाएगा या तो बुखार पाई जाएगी तो उसको देश में ही क्वारंटाइन करने के लिए हमने आदेश जारी कर दिया है।
दिस इज अ डेडिकेटेड जीन सीक्वेंसिंग लैब। इसमें कोविड के टाइम में हमने काफ़ी सारा जो सेकेंड वेव के बाद में जो भी सैंपल आए उनको हमने एनालाइज किया, और आप देखेंगे जो भी पेशेंट आरटी-पीसीआर जिसका पॉजिटिव होता है उसका सबसे पहले हम आरएनए एक्सट्रैक्शन करते हैं। आरएनए जब हमें मिलता है, आरएनए एक्सट्रैक्शन करने के बाद आपने देखा होगा कि यह -78 डिग्री टेम्परेचर है, इस पर आरएनए सैंपल को स्टोर करते हैं। जो फर्दर प्रक्रिया है बहुत एडवांस्ड मोलिकुलर पीसीआर लैब है जिसमें कि सीक्वेंसिंग होती है और ये पता लगाते हैं कि अल्फा वेरिएंट है, बीटा है, डेल्टा है, ओमिक्रॉन है या ओमिक्रॉन का कौन सा सब वेरिएंट है।
कोरोना की चुनौतियों को लेकर के सरकार ने सभी प्रकार से सतर्कता बरतने का निर्देश दिया है, लेकिन मेला क्षेत्र में जो अतिरिक्त सुविधाएं देनी पड़ेगी, दिया जाएगा, लेकिन मेला सकुशल, सुरक्षित, सुव्यवस्थित संपन्न हो, इसके लिए सरकार ने विचार पहले से ही किया हुआ है। पहले ही इस संबंध में चर्चा हो चुकी है।
ಪ್ರಮುಖವಾಗಿರುವಂತಹದ್ದು ಬೂಸ್ಟರ್ ಡೋಸ್ ಅನ್ನು ಹೆಚ್ಚಿಗೆ ಕೊಡುವಂತದ್ದು, ಅದಕ್ಕೆ ಕ್ಯಾಂಪ್ಸ್ಗಳನ್ನು ಮಾಡಿ ತಾಲೂಕಾ ಮತ್ತು ಜಿಲ್ಲಾ ಮಟ್ಟದಲ್ಲಿ ದೊಡ್ಡ ಪ್ರಮಾಣದಲ್ಲಿ ಬೂಸ್ಟರ್ ಡೋಸ್ಗಳನ್ನು ಕೊಡುವಂತಹ ಕೆಲಸ ಆಗಬೇಕು. ಎರಡನೇದಾಗಿ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಬೇಕು. ಪ್ರತಿಯೊಂದು ILI ಸಾರಿ ಕೇಸ್ಗಳಿಗೆ ಕಡ್ಡಾಯವಾಗಿ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಬೇಕು ಅನ್ನುವಂಥದ್ದು ಮತ್ತು ಕ್ಲೋಸ್ ಡೋರ್ ಇದ್ದಲ್ಲಿ ಮಾಸ್ಕ್ ಹಾಕಬೇಕು, ಡಿಸ್ಟೆನ್ಸ್ ಮೇಂಟೈನ್ ಮಾಡಬೇಕು. ಅಲ್ಲದೆ ನಾನು ನಮ್ಮ ಆರೋಗ್ಯ ಸಚಿವರಿಗೆ ಮತ್ತು ಇಲಾಖೆಗೆ ಸೂಚನೆ ಕೊಟ್ಟಿದ್ದೇನೆ. ನೀವು ನಿಮ್ಮ ಆರೋಗ್ಯದ ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಅಂತಂದರೆ ಹಾಸ್ಪಿಟಲ್ ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಅಷ್ಟೇ ಅಲ್ಲ, ಔಷಧಿ, ವ್ಯಾಕ್ಸಿನೇಷನ್ ಇವೆಲ್ಲವನ್ನೂ ಕೂಡ ಹೆಚ್ಚಿನ ರೀತಿಯಲ್ಲಿ ಸ್ಟಾಕ್ ಇಡೋದಕ್ಕೆ ಈಗಿನ ಪ್ರಯತ್ನ ಮಾಡಬೇಕು. ಯಾವುದೇ ಸಂದರ್ಭದಲ್ಲಿ ಯಾವುದೇ ಕೊರತೆಗಳಾಗದಂತೆ ನೋಡ್ಕೋಬೇಕು. ಮತ್ತು ಆಕ್ಸಿಜನ್ ಏನು ನಾವು ಪ್ಲಾಂಟ್ ಹಾಕಿದ್ದೀವಿ, ಎಲ್ಲ ಕಡೆ ಹಾಕಿದ್ದೀವಿ, ಅವುಗಳನ್ನು ಡ್ರೈ.
In wake of the rising COVID-19 cases in India, the Mumbai International Airport has announced certain precautionary measures in order to keep the virus in check. A random testing of the 2% international travelers flying into Mumbai will be tested. Of course, this random testing is going to be recommended by the airlines, who will identify the flyers come passengers and ask them to undergo the testing at the airport. However, masks have not been made mandatory and compulsory in the state of Maharashtra or in Mumbai. Maharashtra Health Minister Tanaji Sawant said that there is no need to panic or there is no cause of concern yet, as the cases are very much in control. But he said, issuing the advisory and clearly stating that it will be better if masks are begun to be used in public places in order to keep the infection rate and the test positivity rate under check. But however, a lot of airlines are also insisting on the fact that the third certificate or the vaccination come booster dose has generally been taken by these passengers. These are the kind of restrictions in the wake of rising cases in the country. However, the flights flying into India from China for the time being have been stopped and have been banned. These kind of discussions were also made by parliamentarians in the ongoing winter session in New Delhi. With cameraman Mahesh More, Dev Kotak for India Today, Mumbai.